Welcome back. This is Gateway 101. Okay, so remember that in Gateway 101 places emphasis on prevention because we strongly believe that prevention is better than cure. So in Gateway 101, we places emphasis on healthcare awareness. And please do not forget that in Gateway 101, we do not diagnose or prescribe treatment. Gateway 101, our common goal is to create healthcare awareness. I will also strongly encourage you to go for your YouTube and for your medical appointment because prevention is always better than cure. We also give you some simple help tips that helps you to prevent illnesses. We also give you some simple home remedy that you can use to help alleviate symptoms. Meanwhile, while this does not constitute medical diagnosis or treatment, this is purely health care awareness, which teaches health care awareness. So, without wasting much of your time today, we're going to be talking about a very, very sensitive topic leukemia. What is leukemia and its impact on health? This is what we're going to be looking at today. We're also going to be looking at a possible warning sign of leukemia that people tend to ignore. Please do not forget that prevention is always better than cure. So let's dive into it. So let's dive into it. So leukemia is, like I have said, is a type of cancer that affects the blood and bone marrow. It's a type of cancer. Leukemia is a cancer. It's a type of cancer that affects the bone marrow. Okay, that affects the blood and the bone marrow. The soft tissue inside your bone where blood cells are made. Leukemia normally affected. Okay, do not forget to subscribe and like. This is a very sensitive topic today. We are talking about cancer, leukemia cancer. It's a very, very sensitive topic. Do not forget to subscribe, share, and like. Okay, so leukemia is a type of cancer that affects the blood and the blood marrow. The soft tissue inside your bones where blood cells are made. Okay, so what happened in leukemia? Normally, your body make healthy blood cell. Red blood cell carry oxygenated blood. White blood cell help fight infections. White platelet help stop bleeding. So if you are bleeding, it is the platelet that helps stop that bleeding. Your white blood cell help fight off infection, while your red blood cell carry oxygenated blood to the body, around the body. So, but in leukemia, the body produce abnormal white blood cell. Do not forget that we just said that white blood cell help fight off infections. Okay, so but in leukemia, the body produce abnormal white blood cells. So these cells don't work properly. They grow out of control, and they crowd out healthy blood cells. So what happened? The impact on health is that leukemia can affect the body in several ways. One, do not forget that the white blood cell help fight off infection, but leukemia weaken the immune system. Okay, because the white blood cells are abnormal, the body cannot fight infection well. So what the result is, you have frequent infection becoming very common because the white blood cells that's supposed to fight your infection, that are supposed to fight off infection, is now compromised. So you can no longer fight infection well. And do not forget that red blood cells carry oxygenated blood. So what happened? One of the impact of leukemia is that abnormal is that no red blood cell anemia, because less oxygen is carried in the body because of leukemia. So you have less oxygen. So the red blood cell is no longer carrying much oxygenated blood around your body. So you carry less oxygen in your body. So this causes you fatigue. You feeling tired, very tired, even from a very simple exercise. You become so tired. You also have shortness of breath. Okay, from a very simple activity, you become so tired. You have shortness of breath because you can no longer breathe properly because the red blood cell can no longer doesn't carry much oxygenated blood around your body. So you have less oxygen. So, and your skin will not look pale, P-A-L-E. Your skin look pale in case of leukemia because you no longer have much oxygen around your body. And also, do not forget that the essence of leukemia is that this abnormal white blood cell that it produces, it crowded the blood cell. Not only the red blood cell, it also affects the platelet. So that makes you bleed and bruise easily because you now have a low platelet. And this can lead to frequent nosebleed. If you see somebody who have a frequent nosebleed, it might be due to leukemia. It might be an early warning sign of leukemia. So pay attention. Okay, if you have bleeding gums, your gum bleed might be an early warning sign of leukemia because leukemia fight off your platelet, fight off your red blood cell, and also fight off the white blood cell. So you become in the case of the low platelet, which help clot bleeding, you now prone to bleeding. You bleed very easily. You also slow healing of cut. Let's say you have a wound, the wound will bleed for a very long time. It will be very difficult to put it under control. Then it also affects your bone and your joint pain. So leukemia cell build up in the bone marrow. It will cause pain or tenderness in your bone because it crowd the bone marrow, crowd the cells. So this will result to pain and tenderness in your bone. It will also go result to a severe joint discomfort. So if you're having bone pain, your bone marrow, bone pain, bone tenderness, you're having a joint discomfort, it might be an early warning sign of leukemia. So we'll always encourage you to pay to go to your medical doctor so that you can seek help. Do not forget that this is Get Well 101. All what we are doing here is to create health care awareness. Okay, we do not diagnose here or prescribe treatment, but we're only giving you a simple help tip that you can use to help prevent a major illness. Because before an illness develops, your body must have given you a warning sign. Okay? Your body must have given you a warning sign, just that you ignore it. Okay? For example, if you are having a frequent nosebleed, why don't you go and seek a medical help? Why don't you go and see your doctor? This might be an early warning sign of leukemia. So this also causes organ problems because abnormal cell can spread and affect organ like your liver. It can also cause swelling in your belly. Your nephron node, swelling gland, because it causes organs problem. It also causes general weaknesses and illness. Okay? People may feel constant tiredness. People may feel feverish or night sweat. You can also lose weight without trying. If you are having a leukemia, you will be losing weight, even though you are not intending to lose weight. You are not trying to lose weight, but suddenly you find yourself losing weight. Okay, these are signs. These are early warning signs of leukemia that you have to pay attention to. Okay, types of leukemia. Leukemia can be acute, that is fast growing. You need urgent treatment. Chronic, slow growing or slower growing, you also need treatment. So what are the common types of leukemia? We have acute nephrocytic leukemia, also known as ALL. You have acute myeloid leukemia, AML. We also have chronic nephrocytic leukemia, CLL, and chronic myeloid leukemia, CML. Okay, so the simple way to understand it is this. You think of your bone marrow like a factory. Okay, in leukemia, the factories start making faulty white blood cells. I don't know whether you're understanding, whether you guys are understanding what I'm trying to say here. The simple way to understand what I'm in a layman language, think of your body or think of your bone marrow like a factory. In leukemia, the factory start making faulty white blood cells that don't do their jobs. They take up space and stop the good cell from being made. I think that is much better. So why is this serious? If leukemia is not treated, if untreated, leukemia can cause severe weakening the immune system. Can severely weaken your immune system, so you are prone to infections. If leukemia is not treated, it can cause life-threatening infection or bleeding. It can also damage your body organs if it is not treated. But the good news is many types of leukemia are treatable, especially when caught early. So this is why we always encourage you that if you are having any of these symptoms that we are mentioning, you should try as much as possible to seek medical help, because if they caught it early, it will prevent complications. Okay, if it is caught early, it will prevent complication. Okay, so it is treatable. Many types of leukemias are treatable. So let's look at early warning signs people often ignore. Okay, so what are the early warning signs that people often ignore? Like I have said, that before you develop a major illness, your body must have given you several signs that you probably ignore. So what treatment and survival rate, we will be talking about that too. Food and lifestyle tips to support someone living with leukemia. Okay, so let's look about the early warning sign people often ignore. Leukemia symptoms can be subtle at first and easy to brush off. For example, constant fatigue, you feeling tired, even after rest. You slept all through the night, rested good, but you constantly feeling tired. These are likely early warning sign of leukemia. Low energy, during normal activities. These are early warning signs that people often ignore. Frequent infections. Do not forget that in case of leukemia, your white blood cell is compromised. Okay, so the white blood cell that's supposed to fight off infection become compromised, so you are prone to infections. So if you are having frequent infection, getting sick often, especially cold, flu, infections, taking longer than usual to recover, this might be a likely warning sign of leukemia. So pay attention to your body because your body do speak to you. Easy bruising or bleeding. If you bruise very easy, you bruise without injury, you have a bleeding gum when brushing, frequent nosebleed, these are early warning signs of leukemia. Fever or night sweat, unexplained fever, waking up at night, sweating, these are likely early warning signs of leukemia. But do not forget, in this channel, we do not diagnose. All we are saying is we are simply teaching you a simple healthcare awareness. So that if you are having all these signs and symptoms, you better seek medical help. Okay? You are having unexplained weight loss. You're losing weight even without trying. You do not intend to lose weight, but you continue to lose weight. Okay? These are early warning signs of leukemia. And do not forget that leukemia is a type of cancer. Okay? You have bone or joint pain, often mistakenly for growing pain or arthritis, might be an early warning sign of leukemia. You having a pale skin, P-A-L-E, pale skin. Your skin became pale because of leukemia. Leukemia attack, it crowd the red blood cell, so making it difficult for red blood cell to carry oxygenated blood all over your body. So you're in that process, your skin become pale. This is unlikely early warning sign of leukemia. So skin become pale due to anemia, no red blood cell. Your nephroid node becomes swelling. Your neck, armpit, or groin may feel swollen but not painful. These are early warning signs of leukemia that people always tend to ignore. Okay, so if you are having a early warning sign that people often ignore, constant fatigue, we'll talk about that already. We'll talk about frequent infection. So if you're having any of these warning signs that I have just mentioned, like I've said, this does not constitute medical diagnosis or treatment. We strongly encourage you to seek medical help with your healthcare provider. These signs are often mistaken for minor illnesses which delay diagnosis. Okay? So let's look at possible treatment option that your medical provider might recommend for you. So we are not recommending any treatment here, but we're always looking at possible treatment option. So treatment depends on the type and stage, but common option will include chemotherapy. So using drug to kill cancer cell, most common treatment. It is the most common treatment for leukemia, chemotherapy. They can also use what we call targeted therapy. So attack a specific cancer cell weaknesses, often fewer side effects than chemo. Okay? Immunotherapy, which help your immune system fight cancer. Don't forget that in leukemia, the white blood cells are compromised. Therefore, it becomes inability to fight infection. So you are prone to infection. That's why you feel sick very frequently. So they can put you on sort of immunotherapy This will kind of help your immune system fight the cancer. Radiation therapy uses high energy ray to destroy cancer cells. Might be put into some sort of radiation therapy that are using ultraviolet rays to destroy the cancer cell. Or stem cell bone marrow transplant that can also be used. Okay, they can use a stem cell bone marrow transplant, which replaces damaged bone marrow with healthy cell. It can offer a chance for long-term remission or cure. So survival rate, general overview, survival depends on age, health, and type of leukemia. Okay, so if your leukemia is caught early, it becomes less complicated to treat. So that's why I will encourage you that if you're having any of these signs and symptoms that I have just mentioned, while this does not constitute medical diagnosis, go to your healthcare provider and seek help. Okay, so survival depends on age, depends on health, and type of leukemia. Acute nephrocytic leukemia, very high survival rate in children, around 85 to 90%. While chronic nephrocytic leukemia, many people live for years or decades. Chronic myeloid leukemia, survival greatly improved with modern drugs. Like I said, leukemia is treatable, but you have to be treated early. Acute myeloid leukemia, more aggressive, but treatable if caught early. Overall, survival rate have improved a lot due to modern medicine. Okay, so food that support the body. Okay, a possible food for somebody living with leukemia. Please don't. This does not cure leukemia, but helps support strength and recovery. So we encourage people living with leukemia to eat iron-rich food such as spinach, beans, lean meat. We also encourage people living with leukemia to eat protein such as egg, fish, chicken, and nuts. Eat a lot of fruit and vegetables such as berries, oranges, and carrot. Whole grain, brown rice, and oat meal. Healthy fat, avocado, and olive oil. These are some of the good food that somebody living with leukemia should be eating. And also, do not forget to stay hydrated. Drink plenty of water. This helps reduce fatigue and support recovery. Food to be careful with if you are dealing with leukemia. If you are somebody with leukemia, food that you should be very, very careful with. If it is possible, totally avoid it will be raw or undercooked meat, egg, raw or undercooked meat. Please stay away from it. If possible, avoid it totally because this increases your risk of infection. Unpasteurized dairy, excess sugars, and highly processed food. If it is possible, you can avoid this food entirely or reduce the intake of it to the lowest minimum. Okay? Alcohol. This can interfere with your treatment if you are someone with leukemia. You try to avoid alcohol or take a very barely minimum. Actually, stay away from it because it can actually interfere with most of your treatment. Okay, you can't be on chemotherapy or are you drinking alcohol? So how does that work? So stay away from alcohol if you are somebody with leukemia. Lifestyle tip to support someone with leukemia. You prioritize rest. Rest is critical. It's crucial for somebody dealing with leukemia. Your body needs extra energy to heal properly. So rest should be prioritized. Rest is critical for somebody dealing with leukemia. Change two activities. You need to do light walking or stretching. This helps maintain strength. If you're somebody with leukemia, stay away from uh, contact sport and also stay away from acrobatic. Okay. Also, this will prevent infection. Prevent infection. Make sure you wash your hand very often if you are somebody with leukemia. Avoid large crowd during treatment. But if you are going through chemotherapy, you don't want to stay around people because your immune system is not compromised. So you are now prone to infection. So avoid large crowd during treatment. Okay, keep your surrounding clean and do not keep flowers around you because you are already prone to infection. So you have to safeguard your environment. You need emotional support. Leukemia can be mentally overwhelming, so you need emotional support. Talking, counseling, or support group. This will help someone living with leukemia. Keep up with your medical care. Regular checkup very crucial for somebody with leukemia. Okay, regular checkups are critical for someone with leukemia. Follow up treatment plan closely. Okay, so the simple takeaway here is leukemia affects the blood, but its impact is felt throughout the entire body. Recognizing early signs, getting proper treatment, and maintaining a healthy lifestyle can make a big difference in outcome. Okay, for the sake of you who are just joining us, we are just going to run through this again so that you can properly understand what we are talking about today. Okay, so we started by saying that leukemia is a type of cancer that affects the blood and bone marrow. We also said that the soft tissue inside your bone where red blood cells are made are affected. So what happens is that normally your body make healthy blood cell. Your red blood cell carries oxygenated blood around your body. The white blood cell fight infection, and the platelet help stop bleeding. So in leukemia, the body produces abnormal white blood cell. These cells don't work properly. They overgrow, they grow out of control, and they crowd out healthy blood cells. So the impact of this on your head will be your immune system become weakened because the red blood cells are abnormal. The body can no longer fight off infection well. So you have frequent infection. That's why you become sick all the time. Then you become anemic because of no red blood cell. That means since you're having less oxygen is carried in the body, you become anemic. This will cause fatigue. You're feeling very tired. You have a shortness of breath. Your skin become pale. And also, you bleed easily. And you also bruise easily because of the low platelet. Okay, so you have frequent low bleeding. You're having your gum is bleeding mostly when you brush. You have a gum bleeding. You easily bleed and slow healing of cord. If you have an injury, it's become almost impossible to stop bleeding. So you bleed excessively. You have bone and joint pain because leukemia cells build up in the bone marrow. So this causing pain or tenderness in your bone. It also causes joint discomfort. It also creates a problem for your body organs. Abnormal cells can spread and affect organs like your liver, okay, your nephron node, swelling gland, It also causes general weakness and illnesses. People may feel constant tiredness, they fever or night sweat, they lose weight even without trying. I will also talk about the type of leukemia. I will say that the acute leukemia is fast growing, it needs urgent treatment. The chronic one also needs treatment but is slower growing. Okay, so we also talk about ways to understand it. A simple way to understand it is that you think of your bone marrow like a factory. In leukemia, the factory starts making faulty white blood cells that does not do their job. It takes up space and stop the good cell from being made. It is serious. If untreated, leukemia can cause severely weaken the immune system. If untreated, leukemia can cause life-threatening infection or bleeding. It can also damage your body organ. But the good news is many types of leukemia are treatable, especially when caught early. Okay, so we also talk about early warning sign that your body will give that people often ignore. But do not forget that before your body develop any major illnesses, your body must have given you an early warning sign that you often ignore. Leukemia symptoms can be subtle at first and easy to brush off. For example, you feeling constant fatigue, feeling tired even after rest. This might be an early warning sign of leukemia, but people often ignore. You're having a low energy during normal activities. This might be an early warning sign that people often ignore. Frequent infection because your white blood cells now compromised. So you are prone to frequent infection. So getting sick often, cold, flu, infections, taking longer than unusual to recover might be an early warning sign of leukemia. Easy bruising or bleeding. You bruise without injury. You bleed, your gums are bleeding when you brush. Frequent nose bleeding. These are possible early warning signs of leukemia. Fever or night sweat, unexplained fever. Waking up sweating. These are early warning signs of leukemia. Unexplained weight loss, losing weight without trying. This might be a possible early warning sign of leukemia. So that's why we strongly encourage you to seek medical help if you're having any of these signs. Okay, your bone or joint pain, often mistakenly for arthritis or growing pain, might be an early warning sign of leukemia. Pale skin, because the red blood cell is compromised, therefore do not carry much oxygenated blood around the body, you will not have a pale skin. This might be an early warning sign of leukemia. Swelling lymph node, your neck, armpit, or groin area may be swollen but not painful. This might be an early warning sign of leukemia. These signs are often mistaken for minor illnesses which delay diagnosis. So if you're having any of these signs I've just mentioned, please do not hesitate to seek medical help because this does not constitute medical diagnosis or treatment. So you go to your medical provider and be properly diagnosed and treated. Okay? The treatment for leukemia, treatment depends on the type and stage, but common also will include chemotherapy. They use drug to kill cancer cell. That is the most common treatment. Targeted therapy, which attack specific cancer cell weaknesses, often fewer side effects than chemo. Immunotherapy, which help your immune system fight cancer. Radiation therapy uses high energy ray to destroy the cancer cell. Do not forget radiation therapy has a lot of side effects, so talk to your healthcare provider. Stem cell, bone marrow transplant replaces damaged bone marrow with healthy cell, can offer a chance for long-term remission, or cure. So survival rate, general overview, survival depends on age, health, and type of leukemia. Okay, for acute lymphocytic leukemia, survival rate is between 85 to 90%. Okay, so chronic nephrotic leukemia, many people live for years or decades. Okay. So your survival rate depends on the type of leukemia and how often it is caught. The overall survival rate have improved a lot due to modern medicine. Okay, we also talk about food that can help support the body. Why this does not cure leukemia, but it helps support strengthen recovery. Good food such as iron-rich food, spinach, beans, limit are very good for someone with leukemia. Protein like egg, fish, chicken, nuts are also very good for someone with leukemia. Eating fruits and vegetables, especially berries, oranges, carrot, they are also of great benefit for someone living with leukemia. Whole grain, brown rice, oatmeal, healthy fat, avocado, olive oil, they are also very good for someone with leukemia. Do not forget, you must stay hydrated, drink plenty of water. This helps reduce fatigue and support recovery. So food that you must stay off of, food to be careful of, food to avoid if you're having leukemia, stay away from raw or undercooked meat. Okay, because this is because this will put you on a very high infection risk if you are eating raw meat or undercooked meat and you're having leukemia. Avoid unpasteurized dairy. Avoid excess sugar and highly processed food if you are someone with leukemia. Okay. Also avoid alcohol because alcohol can interfere with your treatment. Okay, so make sure you lifestyle tip to support someone with leukemia. And we also said that prioritize your rest. The body needs extra energy to heal properly. So you need to have a lot of rest if you're having leukemia. Okay, so gentle activity, light walking or stretching can help maintain strength to prevent infection. Wash and often avoid large crowd during treatment. So this help keep supporting, keep your surrounding clean, okay? And do not keep live flowers around you if you are somebody going through chemotherapy when you're having leukemia. You also need emotional support. Leukemia can be mentally overwhelming. So talking, counseling, and support groups will help. We'll keep up with medical care. Regular checkup are critical. Fellow treatment plan closely. Okay? So the simple takeaway here is leukemia affects the whole body, but the leukemia affects the blood, but its impact is felt throughout the entire body. So recognizing early signs, getting proper treatment, and maintaining a healthy lifestyle can make a big differences in outcome. Do not forget that early signs are awfully subtle. Okay, and treatment are improving rapidly. Healthy habit can make a big difference during recovery. Okay, this is Get Word 101. Thank you all for watching, and do not forget that whatever we are saying here does not constitute medical diagnosis or treatment. We are only giving you a simple health awareness. So if you're having any of these signs that we mentioned, please go to your medical doctor and properly get diagnosed and get treatment because early treatment is crucial if you're having leukemia. Once again, this is Gateway 101. And thank you all for watching. Mr. What's your name? Is it uh, Hiraki Kaka? I don't know what that name is, but you can't be assertive telling me to shut up. I didn't ask you to come to my channel, my friend. Okay, I do ask you to come to my channel. I am giving people healthcare awareness. I never asked you to come here to insult me. That just shows how civilized you are. Okay, that shows how civilized you are. If you go to come to somebody's channel to be writing this kind of stuff, that shows how civilized you. But God bless you for being insultive. Stay blessed and bye for now.